So good morning and good afternoon for wherever you're calling in from. Thank you so much for joining us for today's Prevention Plus Wellness free webinar from here, beautiful St. Augustine, Florida. My name is Dr. Chudley Wirch, and I'm CEO and founder at Prevention Plus Wellness, or PPW. You can see today's topic, targeting sleep behaviors to prevent youth substance use, suicide, and violence. This is a brand new webinar. Just created it, and because Prevention Plus Wellness feels very strongly that there's plenty of research supporting the need for addressing not just substance use prevention, but preventing other chronic disease risk factors associated with substance use, including sleep. That's why we have this topic. And so all PPW programs are integrated. They integrate the promotion of healthy behaviors like sleep, physical activity, sports, nutrition, stress control, and the prevention of substance use. Really, really needed a very cost-effective approach to go about improving the physical and mental well-being of youth and young adults. So anyway, enough of that sales pitch. Let me go ahead and show you what we're going to be doing today. We have 1 hour together, by the way. Ask any questions or make any comments you want. You just go to the Q&A, questions and answers, type it in, and I'll take those at the end of today's webinar in the order that they're found. And so this is your hour. So if there's something I said that doesn't make sense, please help clarify it for. If you have an issue, it's likely other people have a problem as well understanding what I'm saying. So please let me know as we go along. So we've got 4 objectives for today's webinar. We're going to be exploring the associations among sleep and substance use, suicide, as well as broader mental health and violence in U.S. adolescents using the Youth Risk Behavior Survey data set. Secondly, we're going to examine the benefits and the challenges, and I'm going to provide some tips for improving the quantity as well as the quality of sleep among youth. Very, very good content, very important information for all of you. Thirdly, we're going to review recent research examining relationships among sleep and suicide, mental health, violence, substance use in youth. And lastly, we're going to discuss practical implications of all of these data for you, whether you work in substance use prevention, violence prevention, suicide prevention, mental health promote, whatever the area is. If you're here, chances are this content will be of use to you. I hope it is. If not, I hope it's at least interesting to you. And everybody who's registered will receive a link to this recorded webinar. You'll also receive these slides that you're showing today. And I think that's important because there's just a lot of links to information that I'll be sharing with you so that you can explore additional content. And you could share this information with your colleagues, your friends in your region, state, or nation. And we hope that you do that, you do share. Before we launch into the content, let me go ahead and I want to pull up a poll just to find out who's with us today. So I've launched the poll. It's coming your way. It'll just take a minute, depending on the speed of your internet. And there's 4 questions. So I think you can answer just one question for each of those, one response for each of those. So go ahead, and you may need to scroll down to see all 4 questions. So go ahead and take a moment to answer those 4 questions so we get a little sense of who's online today, what your background is, and that may help us a little bit in tailoring today's presentation. By the way, this is I would say sold out, but it's a completely booked, but it's free. So it is completely booked session. We had a lot of interest in this. And this is, again, a brand new webinar that we've created for you. So we've got 63% of you have responded. Let me just give you another minute or so that everybody has a chance to respond. So we get at least 7 out of 10 of you, if not 8 out of 10 of you, have a chance to tell us who you are, where you're from, what your background is, what you're interested in. And that'll help inform today's webinar discussion. So we've got over 74% of you responding. Just wait another 30 seconds. Maybe we can even get 8 out of 10 of you responding. So 77% have responded, almost there, 79%. We just probably need just another couple more of you. Wonderful. Thank you guys. You're awesome for participating. It's wonderful. 83% have responded. So I'm going to stop at this point. I'm going to end the poll. And I'm going to share the results with you. So they'll be coming your way, but I'll read them off right now. So what's your primary specialization? Most of you, 65%, said substance use prevention, but another almost a quarter said mental health promotion. And then there was a small percentage, 10%, that said none or other. I'd love to know, of those of you that responded none or other, what is your specialization? What is it that you're focused on? Because it'd be interesting to know that in relation to the topics. So if you answered none, please go to Q&A and type in what your specialization is. Love to hear from you. Number 2, what groups do you work with mostly? And about almost 70% said adolescents. And that was well ahead of any other group. Young adults was next with adults. Third question. So adolescents, substance use prevention, mental health promotion are who's on the line right now with us today. Number 3, what type of organization do you work for? Community agencies. Well, sort of split. Community agencies, schools, state agencies, coalitions. So lots of different organizations, and even 6% others. Which is interesting. And then lastly, number 4, where are you located? Most of you on the East Coast. So it's noon for those of you here, 45% on the East Coast. But look, we got people in the West Coast, the South, the North, non-contiguous states. And nobody said they're from the outside the US today, which is unusual because normally we will have people from other countries visiting, but that doesn't appear today, at least nobody that's responded. Okay, so let me just pop up the Q&A, by the way. See, I could not open the pool. I understand that. Public health, Darla says, she's from public health. Adolescent substance use disorders treatment, and health and wellness promotion, student affairs in higher education. Fantastic. Thank you guys for sharing your background. Let's go ahead and jump right into it. Let's start. Because we have a lot, I've got a lot of slides I want to share with you. I don't want to, I want to make sure we have time to cover all of them for you. But don't hesitate if you have a question or you want to make a comment, use your Q&A to do that. So healthy lifestyle behaviors, what's the prevalence? So this data is from the Youth Risk Behavior Survey Instrument 2019, the most recent data. So I wanted to show you, according to all high school adolescents in the United States, this is the prevalence of those key wellness behaviors, health promoting behaviors. And down below you can see there they are listed in color: breakfast, sleep, physical activity, fruits 2 or more times a day, vegetables 2 more times a day, and sport, being on a sport team. And so if you go left to right, looking at those columns, you can say the blue column, 33%. That means that 33% of high school adolescents eat breakfast every day of the week. We don't know the quality of that breakfast. We don't know how healthy it is, but that means only 1 in 3 high school adolescents are eating breakfast every day, okay? And next to those, we only have 22% getting 8 or more hours of sleep. Amazing. Like it's 1 in 5 our adolescents, high school adolescents, are getting 8 or more hours of sleep. Some need more than 8 hours of sleep. And right behind that, 23% are getting the required amount of physical activity every day, which is 1 hour of physical movement every day. And that's 23%. So not even 1 in 4 high school adolescents are getting the required amount of physical activity, less are getting the required amount of sleep, only a third are getting eating breakfast every day. 29%, not even 3 out of 10 are eating 2 fruits, servings of fruit a day. Less than that, considerably less, only 14% are eating 3 vegetable servings a day, very low. And then the largest percentage is that we've got over half of high school, US high school adolescents being on a sport team. Okay, so that's sort of the layout. You can see these health behaviors, very, very important to chronic disease development, mental health. We'll cover all of that today. So let's start by looking at associations between sleep and substance use, suicide, and violence among US adolescents. And we are doing this by running crosstabs using the CDC's Youth Risk Behavior tool. And you can do this yourself online. Just Google or search Youth Risk Behavior Survey, find that, tool, online tool, and you could run your own crosstabs, and I'll show you what I'm talking about. Let's take a look at sleep and substance use. And again, this is Youth Risk Behavior Survey data throughout the United States, all high school adolescents, most recent data set 2019. And so now we're looking at those high school adolescents that got 8 or more hours of sleep a night, and we're looking at substance use measures. So let's, and here's the first measure, first alcoholic drink before age 13, which is a real indicator of problem and addictive use, alcohol use disorder in the future, and problematic drinking and problems with drinking. And so here you can see we've got, by the way, if you see the slide, if you look to the far right, this is a significant association. It's not likely due to chance. There's actually something here, some true association. There's the chi-square, if you wanted to look at that. That's the frequency a statistic. There's the number, there's the degrees of freedom, there's the percentage of likelihood that that is an actual association. So it's very, very likely it's association p-value. So let's take a look at the far left-hand column. You've got yes sleep, and then the 2 columns next to it are no sleep. Going back to the far left, you've got 10.4% of those who got 8 or more hours of sleep reporting that they started drinking before age 13. And then I drew that little line from left to right just to get your eyes to look at what I'm looking at. So 10.4% of high school adolescents who were getting 8 or more hours of sleep started, had their first drink before age 13, whereas 16.1% of those who didn't get sleep had started drinking before age 13. In other words, less percentage, 10% if they're getting sleep, 16% drinking before age 13 if they didn't get sleep. So you can see that sleep is associated with less likelihood of drinking early on in one's life, before age 13. And we can continue that by looking at current alcohol use. Current alcohol use is measured in drinking in the past 30 days. Same kind of direction of relationship, very significant relationship. For those that are getting adequate sleep, or at least 8 hours of sleep, I wouldn't say that's adequate necessarily, it depends on the individual youth, but if they get at least 8 hours of sleep every night, 20% of youth, of those that are getting sleep are currently drinking alcohol, whereas those not getting sleep, almost a third of those not getting sleep are currently drinking. So you could see again the same kind of relationship. 8 more hours of sleep is associated with less early alcohol consumption, this previous slide, as well as current drinking. And let's take a look at a measure of binge drinking. 4 more drinks for females, 5 or more for males. In other words, heavy drinking, more problematic, dangerous drinking. And we can see the same kind of a relationship for youth that are getting 8 or more hours of sleep. You get about 10% of those youth that are binge drinking, whereas you get 15% of those not sleeping that are binge drinking. So you got an additional 5%. So again, sleep is associated with less substance use, in this case, binge drinking. And let's take a look at ever smoking cigarettes, same kind of a relationship. 18% of almost 19% of those who are sleeping have ever smoked cigarettes in their lifetime, whereas almost 26% of those who aren't smoking, who aren't getting 8 hours of sleep have ever smoked. So again, relationship showing sleeping associated with less ever smoking, as well as current smoking, 4%. Almost 5% versus 6%. That's a very small relationship, but still significant. The relationship holds out for all of these substances we're looking at. All of these are statistically significant associations with sleep and substance use. Now we're looking at ever vaped an e-cigarette. You've got, again, same kind of a relationship. For those that are getting 8 or more hours of sleep, you have a smaller percentage of those that have ever vaped, 38.9, 39%. Those that aren't getting sleep, you can see the actual chart is reversed for the first time, whereas those that aren't getting sleep, the majority of those that aren't getting sleep have vaped at some time in their life, vaped e-cigarettes, 53%. Over half of those who aren't getting 8 or more hours of sleep have tried e-cigarettes. And that holds true for current e-cigarette use, past 30-day e-cigarette use. Those who get sleep, less likely to vape than those who don't get sleep. Now taking a look at frequent vaping e-cigarettes. Of course, as we go from ever use to current use to frequent use, the numbers get smaller, numbers and proportions of youth using them. And so that's why you see these numbers get smaller, but the association and the relationship holds out. Sleep is associated with less frequent e-cigarette use. Taking a look at ever using marijuana, same kind of a relationship. 28% rounding up of those who sleep have ever used marijuana. Almost 40% of those who don't get 8 or more hours of sleep have ever used marijuana. Same with current marijuana use. Again, going from left to right, you can see the relationship is if for those youth, adolescents that are sleeping regularly, less likely to be current marijuana users, in other words, used in the past 30 days, compared to those youth that do not get 8 or more hours of sleep. That's marijuana use, current marijuana use. Same kind of a relationship with ever using opioids for non-medical reasons. Same relationship. Sleep seems to be protective to a certain extent with ever using opioids, as well as with current use of opioids. And that's for non-medical reasons. How about other substances? Same kind of a relationship between sleep and ever using cocaine. Now the numbers are so low, that's why you'll see these, 0, which is, it wasn't actually 0, but it was a very low percentage, but still the relationship held out. There's still an association. Sleep associated with less likely to ever use cocaine. Sleep is associated with less likely to use inhalants, less likely to use methamphetamines, less likely to ever use hallucinogens, and lastly, less likely to be offered or sold or given illegal drugs in a school setting. Very important because it's associated with actual school environment. Very significant relationship there. So what can we conclude, and what are the implications of all of these relationships between sleep and substance use? Well, first of all, US adolescents getting less than 8 hours of sleep each night were more likely to try, that is to initiate or experiment with, as well as currently use, as well as use heavily or more frequently a wide range of substances that we covered. These substances included those that are more and less commonly used among US adolescents, including drugs sold at school. The implication, I think, at least that comes to my mind of these data, is that sleep behaviors should be targeted by substance use prevention professionals and by organizations with the goal to get youth to have at least, this is adolescents now, at least 8 hours of sleep in hopes of assisting with the prevention of substance use. So 8 hours of sleep, very important goal for prevention of providers, coaches, parents, etc. But let's not stop there. Let's take a look at now the relationship between sleep and suicide, and even a little bit more broadly, mental health. Again, still looking at relationships between high school adolescents throughout the United States, youth risk behavior survey data. The most recent data set is 2019. So let's look at suicide. We see the same relationships with sleep, with some of these indicators of mental health. In other words, here we're looking at getting 8 or more hours of sleep, those youth that got that versus those who didn't, and a measure called feeling sad or hopeless, such that that these youth couldn't do some of their daily routines. This is a really important measure. I think it's indicative of some serious mental problems within the lives of young people. And we could see the tremendous difference for those that got sleep. Less than a quarter reported feeling sad or hopeless. Those who didn't get 8 or more hours of sleep, greater than 4 in 10 reported feeling sad and hopeless. So a very strong relationship there between sleep and feeling sad and hopeless. And now several measures of suicide, starting with seriously considering suicide. Those getting 8 or more hours of sleep, 11% seriously considered suicide. Those not getting 8 or more hours of sleep, almost double the risk level, 21% reporting seriously considering suicide. So a strong relationship there between sleep and seriously considering suicide. Same kind of a relationship between planning to commit suicide. Those getting sleep, 9% planned it. Those not getting 8 or more hours of sleep, almost 18%, again, almost a doubling of the risk of planning to commit suicide associated with not getting that 8 or more hours of sleep. And then lastly, attempting suicide, same kind of a relationship. So what can we conclude? US adolescents who are not getting 8 or more hours of sleep are more likely to experience sadness and hopelessness in their lives, such that it really affects their daily functioning, as well as seriously considering, planning, and attempting suicide. So really, prevention and mental health providers should include getting adequate sleep and high quality sleep as a critical goal for preventing suicide and improving mental health among adolescents. Okay, good relationships, fascinating, powerful. We're not going to stop here, by the way, with just running these analyses. We're going to look at research and see what published research says in relationship to the analyses that we're running using the youth risk behavior survey data. Now let's take a look at sleep and violence and a whole range of violence. You're going to see, again, all these associations are significant, statistically significant, not likely to be due but to chance, but actual associations. We could see that those that get 8 or more hours of sleep are less likely to carry a weapon. Those that get 8 or more hours of sleep are less likely to carry a gun. Those that get 8 or more hours of sleep are less likely to be threatened or injured by a weapon at school. Getting 8 hours of sleep is associated with less likely being electronically bullied. So there's actually an association with victimization, less likely to be an electronic bully victim if they're getting adequate sleep, as well as being bullied at school. Sleep's associated with less likelihood of being bullied at school. Less likely to not go to school because they felt unsafe. So, I mean, it has a very practical implication here of reducing the risk for not going to school because of fear of being unsafe. Sleep is associated with less likelihood of being physically forced to have sexual intercourse. Less likely to experience sexual violence, as well as sexual dating violence. And so we can conclude that US adolescents not getting 8 or more hours of sleep are at risk for a whole range of violence indicators: carrying a weapon, carrying a gun, threatened or injured by a weapon at school, electronically bullied at school, not going to school because it's unsafe, and experiencing a range of sexual violence. So really, increasing sleep among adolescents may help prevent violence perpetration as well as victimization. So really powerful associations between sleep and violence. So what are some of the benefits? What are some of the challenges? And what are some tips for you and parents to help improve youth sleep? This data, this information comes from Teens and Sleep Foundation, just updated 2022. There's the link, so you'll be able to go there and take a look at. Here's the benefits of sleep, a whole range of benefits. You've got thinking and academic achievement. That's the cognitive benefits of sleep. Attention, memory, success in school, brain health. Then you've got emotional health. We know that lack of sleep, especially among adolescents, associated with, I laugh, but it's not funny, mood swings, irritability, all these kinds of things, relationships with other peers, teachers, parents. Emotional health, very important. The third item down on the list, bulleted item, physical health and development. Almost every physical functioning organ system in the body is promoted, is enhanced with sleep, especially during the developmental years of children and adolescents. Next item, decision-making, risky behavior. If you're tired, if you're exhausted, that frontal lobe functioning is affected, and poor decision-making, riskier decision-making is influenced. And lastly, that increases chances for accidents and injuries. We didn't even discuss that, but there's a strong relationship between lack of sleep and increase for accidents and injuries. What are the challenges to getting sleep? There's many of them. So I think it's important to take a moment and look at them. The first is delayed sleep schedule and school start times. We know that as youth age into adolescence, their circadian rhythm changes, their biological need is to go to sleep later. That's just a natural cycle for teens. So they want to fall asleep, and they fall asleep later on. And yet that butts up against the fact that, especially for high school students, they have to get up the earliest to get to school. So it's really a bad situation. They go to sleep later biologically, but they have to get up the earliest to get to school, which prevents them from getting the adequate 8 hours or more sleep that they need. Time pressure is another major factor. School assignments, work, sports, chores, all kinds of things in their lives, so much to do in a day that they don't allow enough time for sleep. And there's, for many youth, pressure to succeed. And this can contribute to sleep problems and going to sleep. So real issues here and challenges to deal with. Electronic devices, good research coming out now showing electronic devices and do make it more difficult to get sleep. There was a study back in 2014 by the Sleep in America poll showed almost 9 out of 10 teens keep at least one device in their bedroom. That's a problem because they're sort of hardwired to listen for that ding or that notification that something's going on, and that prevents them or can prevent them from having sound REM sleep. And also there's some evidence showing that even the exposure to the light from the cell phones can reduce their melatonin, which helps get to sleep and sleep well. Mental health problems. So many youth are struggling with depression, as we saw some of the data we just showed you, anxieties, and these can influence and interfere with the ability to get to sleep and to have sound sleep. There are some youth that have neurodevelopmental disorders, particularly attention deficit hyperactivity or ADHD, as well as autism spectrum disorder, ASD, can make it harder for youth and teens to get to sleep. And also a lack of sleep exacerbates the symptoms of these disorders. And then lastly, there are sleep disorders, not as common, but still, like sleep apnea, for example, while more likely to be with adults like my age, there are some youth that have that as well. What are some tips for youth to get both enough sleep and high quality sleep? Those are both the issues. It's both really important. Not enough to just get 8 hours or whatever numbers of sleep, but the quality of sleep is really important. And so here's some good tips. Having youth reflect on the environment and their sleep behaviors before and during sleep, really important. So it's a sleep hygiene review is critical. That's what you want to have your youth review, their sleep hygiene. You want them to have a consistent pre-bed routine, so there's relaxation, they fall asleep fast, avoiding caffeine, energy drinks, even in the afternoon, but certainly in the evening. Putting away electronic devices, I say lock them up at night so that that's not a factor. There's some evidence showing that parents that have a routine for them or a time set to go to sleep can be effective. Setting up your bed so that it's dark, it's quiet, it's comfortable, including your pillow. And lastly, if you do have sleep problems, do seek a pediatrician to help with those, because it's a very serious issue as we've seen thus far. Parents can help in a lot of different ways. They can start by asking their youth, because the research shows that parents don't know when their teens, may not know when their teens are having sleep problems. Ask them if they're having sleep and if they're getting enough sleep. Encourage them to, parents should encourage their youth to assess their sleep hygiene, their environment, their behaviors, make small changes to improve that. Set a time perhaps for youth to go to sleep, sort of enforce that. There's some research showing that in school districts where later time has been used for high school students, that's improved attendance and academic performance. So supporting school districts to push back the school start time for adolescents, I think, is a good thing. And parents can work with teens to not overschedule themselves so that they can schedule in enough sleep. So what can we conclude from all this? Number one, sleep has tremendous benefits for the mental and physical well-being. Number two, there are real challenges to getting adequate and high quality sleep. And three, but there are tips to accomplish that. And three, parents play a very important role. Let's take a look at some of the science now. This is recent research. Let's start with sleep and substance use. And so there's quite a bit of this. Let me see how much time we got here. Okay, we're doing pretty well. So let's take a look at this. Here's a study, and these are more recent studies. Although this is, I think, one of the later ones, 2018. This was a review of research. I like to show reviews because there's numbers of studies and you get the big picture. This looked at sleep duration and risk-taking in adolescents. And this was published, like I said, in 2018 in Sleep Medicine. And they showed that adolescents that didn't get sufficient sleep were 1.4 times more likely to engage in risk-taking. What was that risk-taking? All kinds of things, including things we're talking about today: alcohol use, drug use, smoking, violent and delinquent behavior, and others. So strong relationship across studies that were viewed linking sleep duration and risk-taking behaviors. Sleep duration and alcohol and cannabis use, specifically looking at those two substances. The study was published in Addictive Behaviors earlier this year. At the day-to-day level, sleep duration was inversely associated with cravings for both alcohol and cannabis. In other words, stronger cravings reported on those mornings and afternoons after relatively short sleep. So we could see that the craving to use is associated with a lack of sleep. Same with burst level, which is burst in this study meant a 2-week period of 14 days. You see that relationship. Bottom line, number 5, shorter sleep duration may be a modifiable risk factor for cannabis use and alcohol use among young adults. These are young adult sample. How about adolescent sleep, alcohol, and cannabis use? We see some similar relationships. We see a whole under number, by the way, this is published in Alcoholism Clinical Experimental Research earlier this year. So this study showed that a number of sleep factors, eveningness, which is the tendency to want to go to bed later, more daytime sleepiness, later weekend sleep timing, and shorter sleep duration, all of those things predicted more severe alcohol binge drinking the following year. So this was a longitudinal. This is more likely to indicate a causative relationship between lack of sleep and substance use. A greater eveningness also predicted more likelihood for cannabis use the following year. And under number 4, very important, middle high school students were more vulnerable to sleep-related risk for cannabis use than young adults. So that middle high school area or age range in particular, very important to address sleep, circadian rhythms, sleep characteristics as potential risk factors for substance use, including binge drinking and including cannabis use. That's among adolescents. Good study there. Another study looking at adolescents' sleep increases in substance use, published in Addictive Behaviors earlier this year, looking at high school students. Students reporting lifetime cannabis use, cannabis as a sleep aid. Now these are individuals, students that are using cannabis as a sleep aid. There are 8% of those in this particular high school sample. They endorsed it. They endorsed using cannabis as a sleep aid, and those individuals had greater depression and anxiety symptoms a year later, as well as greater cannabis, alcohol, and cigarette use 1 year and 2 years later, compared to those youth that didn't report that the cannabis is a sleep aid. Then under number 3, over a year, cannabis sleep aid use was associated with increased cannabis dependency as well as 2-week binge drinking. So the point here under number 4, cannabis sleep aid use among high school students may be associated with exacerbated cannabis dependency symptoms as well as increased drinking and cigarette use, without the benefit of intended sleep aid by cannabis, because cannabis use has not been found to be an effective sleep aid. So this is really important for adolescents to understand this. So a little bit more about this in here in a minute. Right now, in fact, conclusions, implications. There's a need for including sleep behavior in substance use prevention programs for vulnerable adolescents. When I say vulnerable adolescents, I'm talking about all adolescents are vulnerable for sleep, lack of sleep, and poor quality sleep. Secondly, healthy sleep habits should be promoted, number 1. Number 2, links between poor sleep and substance use, greater substance use risk should be highlighted for youth in prevention programs in schools and communities. So I believe young people should understand better the relationships between how sleep is a protective factor and lack of sleep is a risk factor for substance use and problems in their life. So number 3, substance use prevention programs should inform adolescents that using cannabis as a sleep aid, and perhaps even for other medical purposes, is not only ineffective, particularly long-term, but may actually increase their risk for substance use problems. So good content here, reviewing the research associated with, and this is some recent research. I mean, there's so much, but some of the more recent research, including reviews of research, looking at sleep and substance use among young people. Now let's look at sleep patterns and suicide mental health, looking at some recent research. So here's sleep patterns and mental health in US adolescents. This was published in Journal of Pediatrics, 2017. The average, this is a national sample. That's why I wanted to show you this. The average weekend bedtime was 22:37. I think that's 10:37. And sleep duration was 7.7 hours, so less than 8 hours with the average sleep duration for a nationally representative sample, 10,000 high school, US adolescents, I should say 13, 18, so middle school, high school. Anyway, number 3, the core of it, later weeknight bedtime, shorter weeknight, sleep duration is greater, weekend bedtime delay, both short and long-term periods of weekend oversleep associated with greater odds for mood, anxiety, substance use, behavioral disorders, suicidality. I mean, look at it. It's just, relationships with all of these things we've been talking about in terms of not just suicidality and mental health, but also substance use and even physical well-being. So abnormal sleep patterns may actually be markers for untreated mental disorders among adolescents in the United States or even abroad. How about sleep difficulties and suicidality in youth? This is a review of research published earlier this year. Sleep and Health Disparities was the journal. The data overwhelmingly supports an association between suicidality and a range of sleep difficulties. These sleep difficulties included insomnia, short and long sleep, both ends of that spectrum, weekend oversleep, and above and beyond depression symptoms. So sleep, critical factor to target and preventing youth suicide thoughts and actions among young people. That was a review of a number of studies just published this year. Here's another, I can't read, oh, there's the title. Stress, sleep quality, suicide ideation in adolescents. It was a paper published in the Archives of Suicidality last year. And results demonstrated higher odds of endorsing suicide ideation, SI, as stress increased when sleep quality was poor. So there's that, sleep quality goes down, stress goes up, suicide intentions or ideation goes up. And so sleep quality may help identify high-risk adolescents prior to initial suicide ideation. So sleep, again, a good marker for adolescents for mental health problems, including suicide ideation. Sleep problems and suicide in youth, another review published 2 years ago in General Hospital Psychiatry. And there were 10 studies, and of these, 7 found at least one type of sleep problem significantly predicted STB, which is suicidal thoughts and behaviors. So there's this growing body of research supporting sleep problems as a risk factor for suicidal thoughts and behaviors. Again, sleep, very important intervention target. So what can we conclude? Poor sleep patterns may serve as markers for untreated mental health disorders, including suicidality in youth. Sleep is a critical protective factor to target and prevention of youth suicide thoughts and actions, and screening youth for lack of and poor sleep can help identify high-risk youth at risk, high risk for suicide. Lastly, let's take a look at the research on youth sleep patterns and violence. This is recent research. This is sleep. First one is sleep quality predicts aggression in youth, published in Journal of Child Psychology and Psychiatry this year. This was a sample of over 1,200 justice-involved male youth, ages 13 to 24. They found that increases in sleep problems was associated with increases in offending, particularly aggressive / person-related offenses for both adolescents and young adults. So sleep quality, not just the quantity, may be a critical factor for aggressive behaviors for high-risk adolescents and young adults. Here's a study on sleep duration and handgun carrying, published 2 years ago in Sleep Health. And youth who reported sleeping 4 or fewer hours, or 40% had 40% greater odds of carrying a handgun, and 85% greater odds of carrying a handgun to school. So the point here is this severe undersleep, this severe deficit of sleep, 4 or less hours associated with weapon carrying. How about school? I can't read that. It's being blocked off. And sleep problems in adolescents. Anyway, Journal of Affective Disorders published this year on adolescents. And so there are some differences here between boys and girls with regard to sleep problems and mental health. For girls, bullying victimization predicted poor sleep and depression symptoms. For boys, sleep problems predicted bullying perpetration and victimization. And both for boys and girls, severe depression significantly predicted victimization and sleep problems for both boys and girls were positively associated with depression systems. So you could see there's a lot of associations here between bullying and depression and sleep. And there may be some differences between males and females among adolescents. How about cyberbullying and sleep duration among adolescents? Published this year in Sleep Health, looking at adolescents, cybering victimization, as well as perpetration, as well as both, was associated with greater odds of short sleep. And younger students who were not cyberbullied had lower probability of short sleep. So both supporting this idea of a relationship between cyberbullying, victimization, perpetration, or both, and sleep. So involvement in cyberbullying as either a victim or a perpetrator or both was associated with a short sleep duration. And sometimes these relationships can be bidirectional. A lot of times that's what they're suggesting, whereas cyberbullying or bullying in general can impact the quality and duration of sleep. Poor sleep can impact the risk level for perpetration and victimization of bullying in general, as well as cyberbullying. What are the final conclusions of all of this? Because we covered so much. So first of all, with regard to sleep duration, as well as quality and problems of sleep predicts youth aggression, weapon carrying, as well as school and cyberbullying perpetration and victimization. So prevention and health programs should aim to increase the quantity and the quality of sleep to reduce violence and bullying among young people. Sleep is also a critical factor associated with substance use, suicide, and mental health and violence. So the bottom line, the last implication, the last item there, greater attention must be provided to youth sleep quality and quantity by prevention and health providers and parents and other adults to reduce the risk for youth substance use, suicidality, and violence. And that's it. Good content, practical information for those of you in substance use prevention, mental health promotion, young people, children, adolescents, young adults, whatever the case may be. Okay, if you want to learn more about what we provide at Prevention Plus Wellness, where we integrate the promotion of sleep patterns, behaviors, as well as nutrition, as well as sports and physical activity, as well as stress control with substance use prevention, go to preventionpluswellness.com. By the way, we have a lot of free resources on our website. You can contact me if you have questions or comments about what we can provide for you, 904-472-5022, or you can email me at info@preventionpluswellness.com. Let's take a look and see if anybody had any questions or comments. Let's see, Julie had a comment. Can you address the directional nature of sleep and other behaviors you've addressed? For example, which comes first, risky behavior or low amount of sleep? Recommendations for enhancing sleep, when and if other behavior is actually contributing to sleepiness or poor sleep quality. So that's a tremendous question. So as I had already mentioned, a lot of times the research is indicating, or at least suggesting, that there's a duality, or not duality, but a bidirectionality of effectiveness, so of effects. So that with less sleep or poor quality sleep, this can increase the risk for suicide and poor mental health. That may be a direct relationship, or may be mediated by something else like stress or depression, or both. And then the other way around works as well. Somebody who is suicidal and having stress and depression, that can influence negatively the quality of his sleep. So it doesn't, either way, I would say sleep is critical. Sleep is a factor to look at. Sleep is a factor to promote. You looked at the very first slide I showed. What do we have at sleep? We had what, 22% get 8 or more hours of sleep. What was that? Something like a very, very small percentage. Let me go back and see that. What was that slide? The very beginning. I may be wrong there. I should know that by now by heart, but that very first slide right here. Let me just shut this for a second. Sleep, 22%. Like 1 in 5 high school adolescents are getting 8 hours, less than 8 hours, that are getting 8 hours of sleep, and they may need more. So, I mean, it's pervasive, the lack of sleep among adolescents, older adolescents. It's ubiquitous, and it's a problem because, as you saw here, the linkages, the associations between poor sleep and a lack of sleep and substance use, the whole range of substances, as well as suicidality and mental health in general, as well as a whole range of violence behavior. So sleep just has been under our radar as prevention specialists, and so very, very important to address. So recommendations for enhancing sleep, you saw them, you saw the challenges, you saw the tips for improving, you saw the role of parents. I mean, do your own research, look at your own resources, go to our website for more content. But please, and if you want to save time and energy, use Prevention Plus Wellness programs, because they integrate the promotion of sleep with substance use prevention. But sleep quality, quantity, very, very important, and likely a contributing factor to a mental and physical development of youth, including these other things we looked at today. So good question. Let me know if I answered that for you, Julie. Anonymous said, can you address the links to problem gambling, video gaming, excessive screen time? So yes, I mean, in some of our other webinars, we've addressed some other behaviors. I mean, but you would see that there's, we know that health behaviors interact with each other. This is something youth should be taught. We know that, just generally speaking, in broad brush terms, risk behaviors correlate, healthy behaviors correlate. Healthy behaviors help protect against risk behaviors. Risk behaviors make it more difficult for healthy behaviors. So those are just some of the course relationships that you should know about. But certainly, if you can run your own analyses, you can do a quick Google search and say youth sleep and problem gambling, youth sleep and video gaming, youth sleep and excessive screen time use. So these are measures of, at least two of them, gaming and excessive screen time fall under the heading of sedentary behavior. They're sort of the flip side of physical activity and, to a certain extent, sports. So there's certainly a strong relationship between sleep there. Greater sleep, I think, is associated with less screen time. You can correct me if I'm wrong, but I think there's plenty of research supporting that, and you could run your own crosstabs using the Youth Risk Behavior Survey data, and probably a negative association with problem gambling. That is to say, greater sleep, less likely to gamble, although that one in particular I haven't looked at, and I don't recall that a measure in Youth Risk Behavior Survey, but it's certainly in some other data sets, and you can look at research with regard to that. So the bottom line, though, with regard to your question, Anonymous, is that these behaviors are associated. We need to think more broadly in terms of and get out of our silos of looking at problem gambling, looking at e-cigarette use prevention, looking at prevention of marijuana use, looking at prevention or addressing video gaming and excessive screen time, and try to integrate our interventions and address more than multiple behavioral issues, because they integrate, and that's what we have done for years now at Prevention Plus Wellness. Let's see, another question from Anonymous. Could be the same Anonymous or a different Anonymous. Let's see. Oftentimes, limited sleep is related to anxiety as a result of systems of oppression, racism. All of that is true. And this could be addressed simultaneously with substance use. Or how can this be addressed simultaneously with substance use disorder? Well, I mean, you can look at any of these behaviors at an individual level or a broader school, community, social level. Certainly, you're true. Oppression, racism can have an impact on almost all health behaviors, including sleep. At the same time, you want to address sleep hygiene with your youth, and that can really have a positive effect on substance use and substance use disorder development. That's what we're looking at. That's what we found today in our research. So sleep, very, very important. And you may need to broaden the discussion to say, hey, there's broader issues. Some of them you can control, focus on those you can do something about to improve your sleep and to get at that marker. Adolescents, 8 or more hours every night, very, very critical. We're not achieving that. Youth are not achieving, parents are not. Julie comes back and said, yes, your presentation and comments are useful. Directionality recommendations for how. Thank you for that, Julie. Terrence says, is physical activity on the graph of healthy behaviors equal physical activity on the graph of behaviors? Let's take a look at that, Terrence. Yes, PA is physical activity, 1 hour every day. That's what that is. 23% of high school adolescents reach that goal. In other words, not even a quarter of youth are getting the required amount of physical activity. The majority of youth are not eating breakfast. Very few are eating the full amount of fruits and vegetables. Most are not getting adequate sleep. And what is the other thing? They're not eating breakfast every day. So very, very important key behaviors associated with substance use, mental health, suicidality, violence, etc. Teresa says, are we seeing changes in the education system that creates a supportive environment, such as adjusting start times to high schools? Are there any data supporting that? I thought one of the studies that I presented, but maybe it's in another presentation I'm working on. Two things to answer that, Teresa. Number one, yes, we do see that some, and these decisions, by the way, are made on a school district basis. So you'd have to go district by district, but we do see some school districts wising up, if you will, to the critical need for these high school adolescents that want to go to bed biologically later, but have to get up the earliest, by changing and the sleep, the school schedule. And it doesn't have to be changed much. There was one study I just read that showed that I think it was a 30-minute change made a significant difference in the lives of youth. So it doesn't have to be a big change. Remember that one study I showed you? It looked like youth on average, national high school youth were getting 7.7 hours of sleep. So another 30 minutes could make a significant difference. And that 30 minutes could be by moving the school clock 30 minutes back. So small differences. And then there have been a number of recent studies showing this associated with improvements in school functioning and success. So really, really good. Look at and promote and support these school changes for high school students in your region. Roxanne, thank you for all this useful information. I have another CME. Bye, Roxanne. Can you show how to access the full data? I'm not sure what you're talking about there, Anonymous. Thank you for your time. This session is very informative. Thank you. God bless you for all you do for youth and families in your region. If you have a question, send it to me at info@preventionpluswellness.com. I'm happy to help any way I can. And remember, you'll all get the slides. You'll all get the link to the recorded webinar. Have a great day, everyone. Thanks for joining us. Bye-bye.